Okay, welcome students. Today we are going to discuss about reproductive health, okay, and contraception and STDs. So this comes under the chapter, How Do Organisms Reproduce? This is the last topic of this chapter. So what exactly reproductive health is? Reproductive health actually makes sure that physically, emotionally, and socially a person is in its like or his or her well-being state. Okay, so reproductive health encompasses physical, emotional, social well-being in all matters related to reproduction. Okay, now what all things it can contain? So first is family planning. So you can say a parent or you can say a family should plan, or the father or mother should plan accordingly. So they should plan how many children do they want, at what period of time they want, socially, economically, are they able to do that or not. So all these things should be kept in mind, and that is it'll make you reproductive like it'll cause a change toward the reproductive health. Okay, then if we talk about disease prevention, so we should also take care that the reproductive organs are protected and they are not infected with some sort of disease or infections which can cause complications later in having a child. Okay, and then also this contributes ultimately towards a healthier society. Okay, now why contraception is important. Okay, so contraception is it plays very important role in giving every individual their reproductive choices. Okay, so people can plan because sometimes that people won't be having jobs or careers. Sometimes what happens that there are they are under pressure of other things, their job, or maybe other life stresses there, so they can decide when to have a child, because a child obviously it'll need a lot of emotional support, it'll need a lot of financial support, right? So you have to plan accordingly. Now this contraception helps in lots of ways. First, it prevents unplanned pregnancies. Okay, so it allows individuals to plan when they want to have a baby and then they can proceed further with that. Okay, then it maintains the healthy spacing. It ensures the proper gaps between the children for maternal or health or child health. Okay, so suppose if a parent or had like a child just now this year. Okay, so maybe they want to have a gap between the child, and it's healthy for the mother as well to have the gap in the child. Okay, in between two child or three child, so there should be enough gap. So for that purpose also contraception is a very good method. Then supports population balance. So again, like a lot of people end up having a lot of children. So that is I'm not like telling that it is very wrong or right, but I'm just telling you that the population is increasing day by day, right? And everybody is fighting for job, for food, for enough space to live, right? Everybody is living in big buildings, on 70th floor maybe. So all those things, because there is a lot of population. So if we will keep the population in a little bit under control, that will help us not fight over such common or basic resources, and everybody might will get to have everything in their life. Okay, now last is reduces disease transmission. Okay, so a lot of diseases could be transferred through these through sexual reproduction or while the act of intercourse. So to prevent those things also, contraception is very important to prevent such kind of diseases. Okay, now what can be the methods of contraception? So first of all, there is natural method. Okay, in natural method, what happens is withdrawal method is there, safe period, and then fertility awareness tracking. So what happens, what a female can do is, a female can tally her menstrual cycle, and during the ovulation period, she can, or the partner or both of them can avoid having intercourse. So that way, that can also be a natural way of contraception. Okay, that can avoid pregnancy up to some extent, but it is not 100% sure that that can happen. Okay, Then there is withdrawal method. So before the ejaculation of the sperm also, if the partner or the male partner is able to withdraw it, then there is less chances of pregnancy. But then again, I suggest, or I say that this is not the 100% safe method to do it. Then comes the barrier method. So barrier method is the male and female both can use certain external, you can say, contraceptive methods which can prevent pregnancy. So there are in the market, there is male and female condoms which could be used to prevent pregnancy. Then diaphragms, cervical caps, these are also used, these are used inside female body to stop the meeting of the sperm and ovum, you can say. Okay. And then spermicidal barriers, some creams are available which kills the sperms. Okay, so that can be used. Then chemical methods are there. So chemical methods include birth control pills, patches and injections, and spermicidal creams and foams. Again, I told you, right? So this birth control pills, actually, they will give you birth control pills for a month. You have to take it without, forgetting it even for a day. And a certain period of time you have to take, and then you have to, break it for like during your menstrual, and then again you can take it. So that way you can again control the pregnancy. Then intrauterine devices. So there are devices like this, which are, copper T or hormonal IUDs, intrauterine devices. Okay. These can be, again placed inside the female reproductive organ to avoid pregnancy. Okay. All this, is in depth. We will discuss this in our regular classes, that what and how actual devices are and how it works. Okay. Or how are the methods are. Okay. Now surgical, methods are vasectomy, tubectomy, and permanent sterilization. So what happens here in vasectomy, the vast difference, okay, is cut, okay, and then tied. So the sperm will not be released, okay, and that's why it won't be ejaculated and ultimately won't cause, pregnancy. But if we talk about tubectomy, so here fallopian tube is cut, so ovary won't be, it won't be able to reach to the sperm and won't cause any kind of pregnancy. So these are the surgical method. In Hindi, it is called as nasbandi. Okay. So I hope you understood different methods of contraception. Now, some advantages are there. So safe motherhood, it reduces risks of complication during pregnancy and childbirth. Okay. Then second is population control. I have discussed this already. And women empowerment. It gives women also a choice to control whether they want to have a child right now or not. Okay, whether they are ready or not. So in planning of their own career, in their own paths also, they feel empowered with these choices of contraception. What do we have to consider while going for any kind of contraception? So it can have a lot of side effects, some of the methods. Okay, so some methods may cause temporary hormonal changes or physical discomfort, so that you have to keep in mind. Then education required. So proper use requires understanding and consistent application. So you should be able to understand, for example, condoms, right? So condoms, how to apply that or how to use it. So you must know that. Without knowing it, you might end up causing trouble for yourself, right? And then individual suitability. So not all the method is going to work for, because every individual is different. So again, according to what works for a person, they should go for that kind of contraception method. Again, the age for female to marry is 18, and male to, it's like 21. So you have to go through that, and then only you can go through this. Okay, then only you can plan actually to have a kid. All right. So I hope that everybody is aware of that, because if you don't have a career, if you are not emotionally stable, financially stable, if you are dependent on your parent, you cannot decide to have a child. Okay, so avoid getting into such situations. Right. Then comes the, one second, let me move this. Yeah, sexually transmitted disease. So a lot of disease can also occur, while like throughout the intercourse or because of the intercourse. Okay, so what are those diseases? Bacterial STDs could be transferred. Okay, so gonorrhea, syphilis, chlamydia, these are the, diseases which can occur because of bacterial infection being caused due to intercourse. Then viral STDs like HIV/AIDS, hepatitis B, genital herpes, and HPV. These are other diseases which are caused by viral infections. Okay, and then parasitic diseases, so trichomoniasis, pubic lice, and scabies. All these can be caused by parasites. Okay, so again, make sure, like, to avoid these situations, make sure that only one partner is there, right? So don't change partners. Okay, now, preventing STDs. So what you can do? You can use barrier protections, like we already discussed, like condoms are very effective in controlling these, STDs. And then practice safe relationships. So limiting sexual partners, like I already told you, right? You have to limit the sexual partner. You cannot, have multiple partners, because then you do not know about their reproductive health. They might be having some sort of disease, so you might end up having it. So that's why always be aware of your partner's, mental health, reproductive health, and all sort of health which, is there. Okay, and also limit it to one person. Okay, if possible, regular health screening, so you can go for routine checkups, or if you're feeling any kind of symptoms, then also you can go for it, and stay informed. Okay, so comprehensive sex education helps us to get more informed and make right choices or good decisions about our life. Okay, so that we can do to stay aware all the time. Why awareness is important? To dispel any kind of myth, because if no accurate information is there, you might get into trouble some situations. Okay, or dangerous misconceptions can be, caused. Okay, then promotes responsibility. It makes you a responsible citizen, and so that you can make an informed decision about your life, your career, your choices. Okay, and supports equality. Education empowers all genders to take control. So women and men both can have choice to whether, go for a contraception method for, a certain period of time or not. So they both, the partners, can decide and come to a conclusion together. So this supports equality as well. Okay, now I hope you understood everything very well. You can answer the questions now. So name one surgical method of contraception for males and one for female. So we discussed this, right? Then question 2 is give 2 examples of viral STDs. Okay, and lastly, which contraceptive method prevents both pregnancy and STDs as well. Okay, so thank you so much for joining the session. With this, we are done with this topic, how do organisms reproduce. If you have any doubts or queries, you can ask me. Okay, thank you. Take care. Bye-bye.